Hi, I'm Dr. J. Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world and give you expert insights on infectious diseases and public health. This is our weekly episode of Inside Outbreaks. And on these episodes, I review the latest outbreaks of infectious diseases, the outbreaks you need to know about. And I do this with my friend and colleague, Dr. Jon Epstein, a veterinarian, virologist, and disease ecologist who, like me, has spent his career tracking dangerous infectious diseases across all corners of the earth. Thanks, Jon, for joining me today.
Thanks, Jay. It's good to be here. How was your weekend?
It's been going well. You know, one of the things I've noticed in both my clinical work and in my regular life is that the sort of beautiful spring weather we're having in New York is also coming with a side effect that I haven't had since I was a teenager, which is a lot of seasonal allergies. Is that hitting you very much as well too?
It seems to have I've dodged it so far, but I have a lot of friends who have been really struggling with this spring. So I hear that.
Yeah, and it turns out there may be a link to climate change. You know, there's been people who are arguing that because the seasons are extending a little bit warmer and it's altering the way, all the living organisms release pollen and all sorts of other potential allergens in the environment, that we could be into. You and I spent a lot of time talking about how climate change is accelerating the emergence and spread of infectious diseases. But it may also have a role in causing another insult to our immune system, which is allergy conditions.
I know. And it's interesting because, we get accustomed to a certain level of allergy. Maybe we're controlling it with Claritin or Benadryl or something like that. And what I'm also hearing is suddenly those aren't as helpful as they normally are.
Well, thankfully they're working for me, but that's probably because I never needed them. I haven't needed them in, like I said, probably since I was a teenager. But now all of a sudden it's really striking. And so just a reminder to people out there, we all know, you and I talk all the time about the environment impacts our health. And clearly we always talk about infectious diseases, but it does appear that allergic conditions are something else that we need to be thinking about.
Yeah. And I think that, maybe if there's a silver lining, it's that it's been an intense pollen producing spring, but it won't remain that way the whole way through. So at some point it should level off and it should be a little more bearable for people with allergies to be outside, hopefully.
Well, absolutely. Well, and that leads us to our first discussion here about humans and animals that are living outside. And so on May 5th, CDC reported that they're investigating an outbreak that's occurring in multiple states of Salmonella Dhanka, which is a serotype that I actually hadn't heard of before, with 7 cases of this Salmonella strain reported in Florida, Illinois, Missouri, South Dakota, Utah, and Wisconsin. And the cases have reported that their illness onset started sometime between February all the way through the middle of March. And of those cases, 71% of them are reporting they had some contact with backyard chickens or other poultry before their illness began. And 43%, so almost half of them, have been under 5 years of age. And as we know with Salmonella, the true number of cases in states affected by this outbreak is likely a lot higher than it is normally. And one of the things I learned when I first trained at CDC in foodborne diseases is that we generally estimate that for every 1 case of Salmonella that's diagnosed and reported to public health, there may be as many 40 cases in the community. And that's because a lot of people, they get a mild stomach illness and they don't really seek medical care and doctors don't necessarily test for it. So Jon, I thought the only reason we had to be worried about backyard poultry right now was bird flu. Why are we worried about Salmonella as well?
Well, this isn't really anything new. And for those of you who know or just are in the habit of washing your hands after handling raw chicken or raw poultry, it's really because of Salmonella. Salmonella is a bacteria that is very widespread. It's commonly found in poultry, chickens, ducks, turkeys, particularly farmed poultry. And farms do work really hard to keep Salmonella infections down in their poultry flocks, but occasionally get infected birds. And what's important is that this is a fecally spread bacterium, which means that it shows up in chicken poop. It can contaminate surfaces. it can contaminate eggs and eggshells, and it can spread among chickens just through environmental contamination and even by farmers getting it on their clothing and moving it around. So when you have salmonella outbreaks on poultry farms, and this is why it's such an important thing that USDA and CDC do in monitoring this, is that once in a while, contaminated meat gets into the food supply. So you may come home with a package of chicken. It could be fresh chicken, but if you handle that raw chicken and there's salmonella contamination on it, it gets on your hands, you touch your face, you eat with your hands without washing them, and boom, that's when you get infected. So that's fecal oral transmission.
Yeah, I think one of the things that was confusing to me, and I'm not sure whether or not you have a explanation for this, but you of all of my friends would know, is that this was linked to backyard poultry farms. So I assume this is families or groups of families that have a small backyard chickens that they raise, probably for eggs, but maybe also for meat as well too. So what's interesting is that oftentimes we might expect a focal outbreak, right? Like just on that farm itself, but wouldn't necessarily expect it in lots of different farms. Do you have any thoughts on why there might be a strain of salmonella associated with backyard poultry that's occurring in multiple different states?
Well, first of all, Bandaca is a pretty unusual strain. We don't normally talk about that, but nonetheless, salmonella can also be carried by wild birds, and wild birds have the ability to move freely from farm to farm. So it is always possible that backyard flocks are getting contaminated or infected by wild birds mixing in with the flocks. It's also possible that people with backyard poultry might be bringing in new birds from markets they got that were already infected, and maybe they're intermingling with their flocks as well. And so there's a couple of different ways this could be introduced to a backyard flock. So it's not entirely surprising that we're seeing it there.
Yeah, and so just for our listeners out there to get a little bit about the sort of the human illness aspects of salmonella, we do get exposed as humans to salmonella from many different sources, and that's because we have a very complex food supply. So we used to think of salmonella as primarily a disease that was transmitted by meat, particularly poultry products and eggs, but in fact, because of our industrialized food processing system, these type of bacteria can spread on a farm to fresh fruits and vegetables. In fact, probably the majority of the outbreaks that we see in the United States right now are actually associated with fresh fruits and vegetables, and that's because those are, as I just said, fresh, and we don't cook them when we eat them. And when you have these industrial production facilities, even a small amount of contamination can spread to a huge amount of different products. So, we do see, outbreaks from time to time like this, where they're associated with direct contact with animals. We see it a lot, of course, with undercooked or mishandled meat products, but we also see it in a whole range of other food products as well. And then when you get this bacterial infection, it most often leads to abdominal discomfort, diarrhea, what people would commonly consider food poisoning. But not everybody gets sick. But there are some people, particularly young children, the elderly, people with immune compromise, who not only get a severe abdominal illness, this salmonella can actually spread from their gut into their blood system and cause what we call invasive salmonella infection. So it is a bacteria that we worry about because it is not just from animal direct contact, but from lots of different food sources. And though most people do okay with the infection, the vast majority of us actually get some type of symptoms, and a small group end up with this severe illness as well.
And Jay, maybe it's worth mentioning, I mean, you're a CDC guy. How do they know that all these cases of salmonella they found are related to each other?
Yeah, this is actually one of the more interesting things that I think people probably aren't very much aware of, and you learn a lot when you work at CDC. So the question is, how does CDC or any other big public health agency know that there's an outbreak going on of salmonella? So there's an entire pathway, and this pathway of how a disease, gets reported to public health causes us challenges. So let's say you get exposed to salmonella, you contact one of these chickens in your backyard, and you happen to get sick, right? You get abdominal pain, diarrhea. What are the chances that you're going to go to the doctor? I mean, so John, I don't know the last time you had a stomach illness was. Is that something you went to the doctor with, or you just kind of,
No, usually I just rest at home, make sure I'm drinking fluids, just wait it out.
So that's the thing. The vast majority of people, they do that because, in fact, if they just rest and get some fluids and stuff, they'll generally be okay after 1 to 3 days. So we're never going to know about those cases, right? The next thing is, John, whether it's you or whether it's your kids have been to the doctor before, how often does a doctor collect like a stool specimen, say, or do they just say, you know what, you got a stomach bug, it's probably going to get better, just get some hydration and be better?
Yeah, no, this is always the challenge. There's very little diagnosis. The doctor's worried about how severe it is. Is there blood in your poop? Are you really dehydrated? They're looking for things that could be really threatening in terms of whatever it is, but they don't know unless they test whether it's a viral cause or whether it's a bacterial cause.
Yeah, and so that presents one of the biggest problems. That's why I started at the beginning and said that only about 1 in 40 cases of salmonella are ever diagnosed and reported to a public health agency, because there's a huge drop off in who actually seeks medical care, and even if they get medical care, whether or not they ever get infected. So it is actually remarkable how we still detect these outbreaks. And so what happens is, of those 1 in 40 cases of salmonella that actually get reported to a public health agency, those specimens are sent from hospital labs or the Quests or BioReference, the big commercial labs, are then sent to a public health lab. And public health labs then do something we call subtyping. One part of subtyping is doing special types of molecular tests to find out what strain of salmonella, like Mendaka, or even an additional step is to actually look at their molecular fingerprint. Now, in the older days, like when I trained and probably when you did, we kind of literally printed up something that almost looked like a barcode. Now we have the ability to do like molecular tests, so you can actually figure out the DNA sequence of these bacteria. And CDC and the FDA and the USDA all participate in a massive data collection system that looks at these strains of salmonella, these fingerprints of salmonella, and looks and sees if any of them are linked together. And so that's the way you can find, even if only a handful of cases have been detected in multiple states, if all of them get a lab test done, get sent to a public health lab, get this like digital fingerprinting done, and there's a database that links them together, investigators, like people at CDC, at state and local health departments, can then call these patients, or in the kids' situation, the parents, and ask them, hey, what have you been doing in the 10, 14 days before you got this illness?
Yeah, and another reason this is so important is, let's say there are these sporadic looking cases of salmonella, but they're in different states. Well, they might get traced back to poultry that came from a common big farm. And that's why it's so important to trace contamination in the food supply, because if there's a farm that's having an outbreak and they're putting food out that's contaminated, that needs to be stopped. That food needs to be removed from the supermarket shelves. And it's these investigations that tell us where the food came from that might have been contaminated.
Yeah, and this is one of the many reasons I've been so concerned about the sort of the major cuts that this current administration is doing to all of our food safety infrastructure, whether it's the people at CDC and state and local health departments. It's mostly state and local health departments that do this on the ground detective work. They're getting huge cuts. CDC is getting huge cuts. FDA, USDA are getting cuts as well. And every time you take a little piece out of this, like as you've heard already, like our system to detect these, while it works, it isn't the most sensitive system, right? We're missing a lot of cases out there. And if you start taking pieces away from it, its sensitivity goes down. And I think there's one bipartisan issue that we can agree on in health in this country, and that's we all want our food to be safe, right? We all want to eat things that are not infected.
And even a great surveillance system is going to miss some cases. So we should talk about what you out there can do to protect yourself against infection from salmonella. And it starts with the farm. So we talked about small backyard poultry flocks, in this case being the cause of infection. And it's good practice, no matter where you are, if you're having any kind of contact with live poultry, chickens, ducks, geese, turkeys, maybe you're visiting a petting zoo, maybe you're visiting a farm. If you're handling live birds, you should be sure to wash your hands right afterwards, and particularly before you eat anything. Get that contamination off your hands so that you're not going to accidentally infect yourself. That's also true if you're gathering eggs. Sometimes chickens can contaminate eggs with fecal material, and that could get salmonella on the shells. So if you're collecting fresh eggs, which in these days when eggs are really expensive, sometimes it's great to go to a local farm and collect your own eggs. Just make sure you're washing your hands afterwards. And it's probably a good idea also to rinse off the eggshells before you crack those eggs and make your omelet. So really important to wash hands. The second thing is, when you're at home and you're handling raw poultry and eggs, make sure not only are you washing your hands, but it's a good idea to probably wipe down surfaces with soap and water, disinfect surfaces in your kitchen after you're preparing raw poultry. This will make sure there isn't any lingering bacterial contamination on the surfaces. So that's really going to help reduce the risk of infection.
What do you think about raw cookie dough? There's a tension in my family, which is I do not eat raw cookie dough because I trained at CDC
I
in
know.
foodborne diseases. And we learned that eggs, unfortunately, get a common strain of Salmonella, Salmonella enteritidis, that makes us sick. So I stay away from uncooked or raw eggs.
I think it's probably a good idea. I mean, I'm not a fan of it myself. I know lots of kids like to eat that, and we have to be careful with kids because they're even more sensitive to bacterial infection than adults. They a smaller dose is likely to make them sick. So we do want to protect our children. And Jay, I would be remiss if I didn't bring up one more salmonella related thing, although it's got nothing to do with backyard poultry flocks or poultry at all. But there is another risk for salmonella infection, and that is handling reptiles. Now, I'm a huge reptile fan. I don't know if you are, but I love snakes and lizards and turtles, but I love them in the wild. I love seeing wild reptiles. And I know that turtles are a really popular pet to have, and they make great pets for kids. But it's really important to know that reptiles also carry salmonella, and turtles are a common culprit of salmonella infection. So if you're handling aquatic turtles, especially, and you're handling them, make sure you have kids wash their hands. In fact, there's even a law in the United States that pet stores are not allowed to sell small turtles that are smaller than 4 inches because little kids are likely to put them in their mouth or, have contact with them in a way that gets them infected. So reptiles can be another source of salmonella infection. Be sure to wash your hands after handling them.
Yep, this is one of the many, during my first 2 years of training at CDC in foodborne and diarrheal diseases, we learned all about this outbreak that was originally identified with, small pet turtles and kids putting them in their mouth. And, we learned about it as part of the sort of training in not just how do people get sick, but why outbreak investigations are so important, right? Like we learned that outbreak investigations are like plane crashes. Sure, the plane has crashed, the people have died. It's a tragedy and there's nothing you can do about it for those people, but you investigate a plane crash rigorously because there may be something you can do to prevent a plane crash in the future. So we look at outbreaks, particularly foodborne outbreaks, exactly the same way. They may reveal gaps in our ability to prevent illness that we can fix. And sure enough, one of the big outcomes of a salmonella investigation decades ago was banning small pet turtles from pet stores to prevent kids from getting sick from this infection.
Yeah, no, it's great. So this all, I think, fits under the umbrella of preventable disease. There's a lot we can do to keep ourselves safe. It's not that difficult. It's really about hand washing and hygiene and sanitation. And so that's why it's so important to remind people about that.
Sure, but I guess the one area that I would extend this discussion to a little bit more is there is absolutely a lot that we as individuals can do, and Jon's laid out for all the viewers out there some of the very important ways we can improve our hygiene, whether it's handling pets or animals raised for food, whether it's handling our food and our eggs. But it can't just rest on us. One of the most important things I learned in my training on foodborne diseases was how important we need to have layers of safety built in so that, food that comes to us maybe doesn't have to be handled with like 100% perfection. I mean, who among us can be perfect every time? And so that's why I'm really concerned about one of the many decisions that's been made by this new administration recently. So, Jon, I'm not sure if you know about this, but there's been this ongoing battle sort of between the food industry and food regulators in the US government about how to classify salmonella. And under the Biden administration, they had put in place a regulation that was soon to take effect that would have set very clear standards, enforceable limits on dangerous salmonella strains in chicken that is sold to the public. And it was estimated that this rule would prevent somewhere over 100,000 illnesses every year from salmonella and other bacteria. And the USDA, however, under the Trump administration, has suddenly decided to pull or at least put that proposal enforcement regulation on hold, saying that it's too expensive and it's not feasible for food producers to make and to impose this regulation. And this really frustrates me. I mean, almost to the point of making me angry. It should be obvious. Salmonella is a contaminant. It is not a nutrient. Okay. It's not something that we want to ingest. And food safety is not something that's optional, and it needs strong enforceable standards, right? Like, just like we can put air filters in our home to clean the air, we also want the air that's coming out of factories and of cars to be clean so we don't have to clean it as much. And I think the same is really true, in my opinion, when it comes to poultry products.
No, I absolutely agree. For better or worse, we have an industry in America of, mass production of meat and farming. And whatever you think about that style of livestock raising, it definitely comes with obligation and responsibility on the end of the producer. They have to make sure the product they're putting out there is safe as best they can. And sometimes it takes regulation to make sure that there is compliance with that.
Yeah, and the whole entire origin of having an FDA in the United States, which began in 1906, was when the first law was passed, was because there was a recognition that we as individuals alone only have so much ability to
Mhm.
keep ourselves healthy, and it does mean that everybody has a communal responsibility in setting some very basic rules on, hey, if you're gonna sell chicken at a grocery store, it has to have a lower level of salmonella. Um, I honestly think that should not be controversial at all.
Yeah. Well, we'll see how this plays out, but we have to also advocate and lobby to lawmakers, to policymakers to maintain and improve health, food safety regulation.
Yeah, and I do think this is one of the areas in which your voice out there for people out there is going to have an impact. Again, I view food safety as something that is really a very bipartisan issue. It doesn't matter if you're a Democrat or Republican, or even if your congressperson is. They'd have a hard time defending why they want to sell food that's dangerous to you.
Hmm.
But that also leads us to another related type of disease and another concern we have, which is about vaccine preventable diseases. So just like you can get nausea and vomiting and an upset stomach from salmonella, I as a doctor, whenever I see a patient, who's coming in with those symptoms, I'm also really careful to make sure they don't have any signs of yellowing of their eyes or yellowing of their skin, because another infection that can cause you, get an upset stomach, is something called hepatitis A. And it turns out that there is an outbreak now that has just been declared in Los Angeles County. And they've declared a community-wide hepatitis A outbreak following a sharp rise in cases and increased levels of the virus detected in wastewater. Since 2024, there have been 165 cases of hepatitis A confirmed in LA County, which is 3 times the number in 2023. And most of the 29 cases that have been identified in 2025, in this current year, have occurred in people who don't really have any of the common risk factors that we would think about, such as traveling or maybe being homeless. And this is worrisome to the LA County Health Department because they're really worried about a broad community-wide outbreak of this infection.
Yeah, well, we think sometimes about hepatitis A outbreaks being due to food contamination. Again, this is a fecal oral virus, just like we were talking about salmonella. This is one that can be spread with poor sanitation and hygiene. So sometimes people preparing food for large groups can cause a hepatitis A outbreak. It's important to trace this back to the source and understand how people are getting infected in order to, to stem the source of it, and then also deal with vaccination as a preventative for people who might be exposed to it.
Yeah, absolutely. I mean, just like you mentioned, there are multiple different ways in which hepatitis A can be transmitted. During my career, I've had several outbreak investigations where we traced a hepatitis A outbreak due to like a common food source. And as I mentioned before about fresh fruits and vegetables, there have been more than one outbreak linked to like frozen fruits that get imported from parts of Central America or other parts of Latin America. Small amount of contamination in the packaging facility, all the fruits get contaminated. And because you don't drink and because you don't heat up fresh, frozen fruit, you eat it raw, you can get an outbreak from it. But there is also the concern that it can be spread person to person. This is a highly contagious infection that causes abdominal discomfort and damages your liver. And that illness can last from weeks to months. And most people who get the infection do okay with it, but some people can get very severe liver disease, even requiring them to get a liver transplant as well.
Now, Jay, do you think the recommendation for vaccination is really, in this case, linked to a known outbreak? This is not a general recommendation for most people, is it?
So there is actually in the United States now a general recommendation that all kids get vaccinated against hepatitis A.
Hmm.
So we have seen declining rates of infection in the United States because of this effective vaccine. When I first went into my medical training, we were taught that the vaccine was only recommended in areas which had a particularly high level of hepatitis A in the community. But over time, that's just become a broad general recommendation. And so we know vaccination is the best way to prevent disease. and it can also be used in somebody who's recently been infected, because there's what we call an incubation period. It can take days to sometimes even weeks until you get that illness after you've eaten a contaminated product or touched somebody that had hepatitis A. And so you can actually vaccinate people as what we call post-exposure prophylaxis. But more importantly, we give people who've been exposed something called an immune globulin or gamma globulin to prevent that disease. And unfortunately, we don't have any drugs to treat it. So the best we can do is, if you've been exposed, is get you vaccinated as soon as possible and get you that gamma globulin. And right now, what LA is doing to respond to this is really trying as much as possible to find adults and children who haven't gotten Hep A vaccination and get them vaccinated. But it's a real challenge, and it's a particular challenge in a place like Los Angeles, which is a very large homeless population, and people who are homeless don't have access to the best sanitation and hygiene. So, and of course, don't have access to the best healthcare. So that's a group that really is at high risk for hepatitis A, but is also at risk for not being vaccinated.
Gotcha. Yeah, no, it's an important message. I mean, it was a while ago, but I got vaccinated for it because it was required by Massachusetts state law when I, got my veterinary license and was practicing, that we had to be vaccinated against hepatitis A. So there was that. And then, kids are vaccinated too, if that's one of the recommended requirements.
Well, it's important you mention it there, because this is, for those of us who work in infectious diseases and preventing infectious diseases, it's one of the reasons we believe so strongly in vaccine requirements. Like Jon, you're at high. You would have been at high risk for this disease because you travel all over the world to places that have a lot of hepatitis A and don't have the best water and food and sanitation systems. So, but the fact that you were required to get it as part of your medical training or your veterinary training helped protect you in the future from something you never probably thought you would maybe necessarily even be doing.
That's right. I mean, it makes sense. And it certainly, as my career transitioned from clinical practice to, global research, it absolutely became essential. And so, had I not gotten it then, I would have gotten it anyway. But you're right. And especially for those who travel, you have to be vigilant about understanding what infectious diseases are prevalent in the location that you're going to.
Okay. Well, on that note, I want to thank you, Jon, for joining me today to talk about potpourri of infectious diseases and even a little bit about allergies. And if you're a viewer out there and you enjoyed this episode, please help us out and help your community out by hitting the like button, hitting subscribe, and sharing this episode and all of our other episodes with your, friends, family, other colleagues. And stay tuned to this channel, Thermometer, for more expert insights on infectious diseases and public health.
Jay, I'm going to make a suggestion, because I always feel like I always feel like I'm leaving these episodes somewhat like depressed that, I was going to enjoy lunch and now I have no appetite because all we've talked about is enteric disease. Maybe we need an episode that talks about really fun, healthy activities people can do that doesn't put them at risk for infectious disease and improves their health at the same time. We need like a wellness episode once in a while, I think, just to kick up the spirits a little bit.
You're absolutely right. And to be honest, this touches on one of the concerns that I have, which is that, one of the battles that we're facing, as is this pushback against wellness influencers who are touting non-evidence-based recommendations.
Right.
There's a natural human reason why they succeed, right? You and I are talking about doom and gloom and how to stop yourself from getting sick, and they're talking about ways how you can enjoy your life better.
So, right? Jay, I'm putting it on the table right now. You and I are going to come in with an evidence-based, science-based wellness episode that talks about all the great things people can do to both avoid infection and improve their health.
All right. Sounds like a good challenge. All right, everybody. So stay tuned for more episodes and hopefully some more uplifting messages as well. Have a good day.
All right. Take care, Jay.